The Health Professional Simulation Building opened in 2012 and is equipped with 25 state-of-the-art high-fidelity Garmin mannequins. These areas are used by our interns training at the local hospitals, RN, LVN, and Respiratory, CNA, plus a few others. There are 2 wards set up just like real hospitals. We have 7 hospital beds and 4 exam rooms that can be used just as you would in a doctor's office or visit the emergency room. And in fact, we have communications with the local hospitals that if the need ever arises, they can be used to help treat patients. Both wards have control rooms where the instructor runs the scenarios and records every simulation to be viewed by the instructor or students or for debriefing. In Ward 1, you can also find our CCU, Cardiac Care Unit, which also is used for pediatrics. Ward 2 houses LDR, Labor Delivery Room, which simulates a mom delivering a baby. The baby has its own sets of vital signs and can also carry and move its arms, showing signs of breathing with its chest rising and falling, including breathing sounds. There is also an department that is or can be used by all programs. Occupational Therapy, Physical Therapy, and EMS paramedics mainly use this area to facilitate real-life surroundings they may encounter in the field. A trauma room, which is also like a real-world trauma room. We also have a 3D virtual dissector. And briefing rooms are equipped with a computer and projector to play recorded simulations. On the second floor of the same building, under Health Profession Nursing, there are 2 labs side by side with each having 7 beds to practice on. Also, across the hallway, there are 4 private simulation hospital rooms that are a mirror image of each other where the students train in a real-world setting, all while being recorded. The Health Professions building, which was remodeled and also opened up in 2012, houses the Respiratory Simulation Lab and the Surgical Tech Lab. The Respiratory Simulation Lab has 10 beds with 10 mannequins, 2 preemies, 1 5-year-old, 7 adults, helps students learn to provide care for patients with lung disease and injuries that affect lung functions and simulated clinical practices prior to entering the hospital environment and other clinical affiliates for clinical training. The Surgical Tech Lab for MCC Surgical Technology program trains students through strict aseptic technique guidelines to function as one of the sterile team members in the preparation, setup, and maintenance of a sterile field.